it's actually interfering with the action of the solar-induced vitamin D.
Yeah, no,
So it shouldn't be on the market. I remember a cartoon of a family of rats sitting at a table, and there's a cupboard, and there's a big box that says rat poison on the cupboard. And the mother says, I don't know why we keep this stuff. I don't know. Same with vitamin D2. There's no rationale to have it or to take it.
The other angle on this same thing is the calcium. Now, I aspire to drinking natural milk, unpasteurized and not homogenized. I aspire to that and I feel good for that, but is there a certain amount of milk or kind of milk or what kind of weight of the calcium that goes into this package?
The 325 milligrams of calcium in a cup of milk, raw, pasteurized, unpasteurized, that's up to you how you want to drink it.
Just
That's
one
not
cup a
going to change
day?
the calcium content. And
One-
how much calcium should you consume? Well, most people are advised to consume a minimum of 1,000 IU a day, but some postmenopausal women or people who are in trouble with their bone density may need to take considerably more. And that has to be an individual thing that's worked out with the doctor. Could be 1,500 milligrams a day for a woman who is seriously vitamin D deficient and is not taking estrogen. But that's a personal decision that's made in conjunction with an endocrinologist.
And it's up to 1,000 for regular.
For everybody, we probably should all be taking 1,000. But it's the higher reaches that are trickier, and especially in older people.
Thank you.
Certainly.
Thank you for your talk.
Sure.
The doctor that I like to see, I take a bone supplement which has a lot of things in it.
Yes.
And he said just take 2 capsules, and in those 2 capsules there's just 300 milligrams of calcium. And also if you take too much calcium, I think it lowers the magnesium. And I think his view is that if you have too much calcium, it can get into the arteries, or I forgot all the negative side of it.
Yeah.
Although most people do say take 1,000 or 1,500.
Well, we know that 1,000 is pretty good, because in that randomized controlled clinical trial by Joan Lappy that I showed you, where we got rid of 4 out of 5 cancers in postmenopausal women in breast cancer. They were taking 1,000 milligrams a day of calcium as a supplement, so it's got to be good. And it's just the only time you have to be careful is in someone who has lost homeostatic control, the so-called control that the body has of the level of calcium. And that comes sometimes at age 70, 75, 80. Then it's good to measure the calcium to be sure it's not getting up too high. But it's easy to measure. It shouldn't be a worry. It should be, oh, well, let's check your calcium. As long as it's not too high, then we're not going to worry about the amount of calcium that you're taking. And usually you're not going to get above 1,500. Nobody takes more than 2,000 milligrams a day of calcium. So it's a range that should be worked out in conjunction with the doctor, but it should be based on your measurements, particularly as you get older. Not now, but older in life. You'll find that that's when the homeostasis gets weaker, and that's when you have to measure it.
Maybe it was good on that graph because of the D, not so much because of the calcium.
Well, you can tell how much it was the calcium, how much was the D, because one group got calcium and vitamin D, and one group got just the calcium. And the vitamin D added quite a bit of benefit to it. But the calcium was producing some itself.
And if you
Unfortunately, there wasn't a group that just got the vitamin D.
if you have too much calcium, I think you can be magnesium deficient, which.
Well, you know how you address that is just take magnesium, at least 300 milligrams a day. And, that can be monitored in blood too. Normally it stays within a pretty well homeostatically regulated range. But beyond age 70 or so, it might be a good idea to measure the serum calcium. It's a good idea to monitor it. It comes with a test anyway. If you get a chemical test, it's almost always got magnesium in it. And if it gets wildly low, then you want to address it. But everybody can take 300 to 400 milligrams a day and not think twice. That's a good idea. Very good idea, actually. Yes, ma'am.
In the Joan Lappy clinical trial, what level of D was maintained?
40 nanograms per ml. There were 30 when they joined the study, and that 1,000 IU brought up to 40, which is about what happened. If you take 1,000 IU, your 25 OHD goes up 10. The rule of thumb. Yes.
So you had mentioned something around sort of getting to the causes of breast cancer around the occupational hazards and
Yes.
how occupation is not sort of related to breast cancer. And I wanted to just make a question here
Yeah.
related to, I think the talk that you're giving about vitamin D relates to prevention, but
Yes.
there's so many cases of breast cancer that we have no idea what the cause is. And I'm just wondering where sort of the research around vitamin D prevention sort of fits with looking at what are the causes of breast cancer.
Well, classically, when you have a disease that's due to a carcinogen, there is a cycle in society of handling the carcinogen, like a pesticide. There's somebody that puts it in the bags, and there's somebody that takes it out of the barrels. Those people who work in the factory, whoa, they've got very high rates, like a bladder cancer in the rubber industry, or people that handle naphthalene, or you see this big deal. It's it's a very strong effect in the workers. You don't see that in breast cancer except for night shift workers. That's the occupational group that gets more of it. And we think it's because there are people that, when you work on a night shift, you often end up sleeping during the middle part of the day, which is when you can make the ultraviolet B. Other people think it's related to melatonin. And, we could duke it out here. We could have half the room on the melatonin and half the room on vitamin D. I'm pretty positive we could win that one on the vitamin D if it came to blows, So that's the main occupational association. It isn't surprising that it would be. And it points in the same direction, namely if we could supplement those people who are night shift workers, many of them are nurses, we could probably reduce their risk to normal. John Platt? Pardon me.
So you had a graph that showed kind of a dose-response relationship between the incidence rate of, I can't remember if it was colon, it was probably breast cancer, and the amount of vitamin D, and then it stops, I can't remember, maybe 40 or 50
Yes.
nanograms. What's the potential here, in your opinion, for reduction? I mean, how many cases, for example, are there of breast cancer? I think you have that up there, or colon cancer, and what is the potential of vitamin D, in your opinion, to eliminate, how many of those cases? What are we really talking about here? Does that line continue downward, in your opinion, as?
Yes, and we have a study that's pertinent to it. Lorraine Lowe and her colleagues in England actually did a study that took it all the way up to 70 nanograms per ml, and there was a 70% reduction. So it looks like you get 1% less breast cancer for every nanogram of 25-OHD. So if we got people up to 80, I'm positive that we would get rid of 80% of breast cancer.
80% of breast cancer.
80%. And above that, I'm guessing that it would continue down to zero, because most deficiency diseases don't peter out. You just, as you pump in more vitamin C into the system, you get less scurvy, and it doesn't change, it doesn't go up, it just goes down to zero. And that's true for pellagra, it's true for very. I remember I was in a debate once with a woman that said, Dr. Garland says that breast cancer is a deficiency disease with a full plosive D. I thought, oh, pardon me, man. But that's what it is, believe it or not. Even though other things can contribute to it, ultimately, it's another one of the long history of deficiency diseases. And yes, the only evidence that we have is that as that vitamin D level goes up in the blood, that incidence rate goes down.
So you're saying that most cases of breast cancer would be eliminated if people had enough vitamin D?
Yes, absolutely.
And that's-
80% if they had 80.
And can the same be said for colon cancer?
Oh, yeah, colon cancer will absolutely disappear at about that level, about 80 nanograms. And that we have, beyond a doubt, solidity of information on.
Do you have a website that we can read? Excuse me.
Grassroots Health would be the choice, or SUNARC. Grassrootshealth.org or sunarc.org. That's Dr.
I like my website too.
Yeah, Dr. Cannell has a website, and Dr. Lahore has a website.
So you
Those are
mentioned
good resources.
other cancers than breast cancer, the colon cancer, the lung cancer. You never mentioned ovarian cancer. Is that totally a different subject? Or just vitamin?
Well, it's not totally. It turns out that it is sensitive to vitamin D, just not as much as the other cancers. It looks like in women who are overweight, the vitamin D will, in the Women's Health Study, will reduce the incidence substantially of ovarian cancer. But in women of normal weight, it doesn't seem to do it. So it's kind of a mystery as to why that's true. It may be that in the women that are overweight, their vitamin D is getting diluted in so much body mass that they really need it, that they need a huge amount of vitamin D to prevent. I'm guessing that. But with colon cancer, with breast cancer, a lot of these studies now, they find essentially the same result. There's a little more variation in terms of ovarian cancer, but it certainly can't hurt. And if someone has a family history of it, or even in a community, it would be a good idea to take the vitamin D in order to reduce the incidence in overweight women, which are at least 30% of our population, female population.
What about somebody in Angelina Jolie's situation? Not that it would be advisable, but what if somebody did have that defect?
Oh, Angelina Jolie?
If they took more vitamin D, would it have any effect?
I think it would, but she got boxed in because she took the test. She paid $3,000 many times over. A lot of women wouldn't want to spend the money, but then they don't want to have the anxiety, and only 30% of the women that get a positive test choose to do what she did. But I don't blame her for doing it. I think, it's a rational choice that she's taken, and a courageous one in a way. And it's fine with me that she did it. But there's every reason to believe that rather than getting every woman tested, which has been proposed, and then finding this 5% that have the gene, and then taking off their breast, that same energy and money could be devoted to giving everyone vitamin D. And if the dynamite theory is correct, it would be fine. They would not have a higher risk, because if you keep the cells as a unicellular monolayer on the inside of these spheres, the terminal ductal units, it doesn't matter what their genetic composition is, because they will go through their life cycle from birth to death in approximately 28 days, and they'll never compete, and they'll never evolve further into a cancer. So I would have no uncertainty about giving vitamin D to someone like Angelina Jolie. And, watchful waiting, being careful, but I think that it's just as likely to help her as it would anyone else.
I come from a family, a very large family with 7 girls, and of the 7 girls, 6 of them have developed breast cancer, and we've all been tested by Dana-Farber. 4 of them have died. I'm the only one that had tested not negative.
You're not positive for BRCA.
Out of the 7 girls.
Well, it is a boxer, and once you're tested, once you're positive, it's very logical to have your breast taken off. Because Jolie said that her computed risk was 87%, most experts say it's 60%, but it's still too high to live with. So the decision has to come early. The person has to decide, I'm going to go with vitamin D and a natural, healthy life, and forget about getting tested for it. And that would be the decision I would make if I were in that position. But if somehow I got talked into having the test and were positive, I'd feel just as she does.
Do you actually think that vitamin D in that situation with the genetic defect could actually prevent?
Well, we would all be speculating because we haven't had the trial. Although this would be perfectly suited to doing a trial because we can find the people, we can assign them the vitamin D and it's not like there's the urgency of time because we can start putting everyone on vitamin D in the meantime. But for the next generation, we would know, that even helps with that. So I can't tell you with certainty. But given the dynamite model and the idea that this is a mutation which confers the tendency to evolve toward cancer, if you get rid of the evolution, if you stop the process of evolution in its earliest stage, chances are it doesn't matter what the genetic code is or how many polymorphisms there are in it, because that cell is going to live and die as a epithelial cell in a monolayer, and it's not going to matter. That would be my guess.
I have breast and colon cancer, and what I want to ask, how much vitamin D would you suggest I should take every day?
Well, it depends on what your vitamin D level is. Now, you're very fair, so I'm guessing it's, unless you're supplementing with a lot of it, it's probably very low. And the way to find out is to ask your doctor to test it, or to go to the grassrootshealth.org
And let's say if it is
website.
low, how much should I?
Now, what should it be? It should be at least 40 nanograms per ml,
Right.
and arguably higher. I think since you have both diseases, an argument could be made
But I
it should be 80 nanograms
be
per ml.
pesticide free.
I would go up, if I were you, just speaking as if you were I and I were you, I would go for 80 nanograms per ml because it's not
80
toxic
nanograms.
until you get up quite a bit higher. Most people say 200, 250 is a widely accepted number for the toxic level of 25 hydroxy vitamin D. And since the risk-benefit ratio would be so much, is change for you than it
Yeah.
is from the ordinary citizen, that you'd be wise to go up to 80 nanograms.
80 milligrams a day.
Nanograms per ml.
Yeah, thank you.
Sure.
How much vitamin D would she take in the meantime while you're trying to get up to that?
Well, I wouldn't take less than 4,000 international units a day.
Mm-hmm.
But I'd get the measurements done post-haste because you might need 10,000,
I
you
know.
might need 15,000.
Yeah.
It's got to be a nuanced decision that you make in conjunction with your doctor.
Mm-hmm.
And if your doctor isn't willing to discuss it with you or do the test, you got the wrong doctor. Like, find one that's, reading the medical literature up on what can be done to, enhance survival. And I've shown you two studies, one from Dana-Farber actually, it's a Harvard study, by Kimmy Ning and Charlie Fuchs and their colleagues that found that, sure enough, a woman was about twice as likely to survive during the next 10 years if her vitamin D level was higher. And the same is true for colon cancer. So you've got two reasons, based on studies that are already been published, that we should be getting a very high vitamin D intake and a very high serum level. Thank you for asking the question.
Is there a special test for the vitamin D level by name that you should ask your doctor
Oh,
to use
yes.
this
I would
test?
advise writing it down because you can get all mixed up, and so can the doctor. It's 25 hydroxy, HYDROXY, vitamin D.
That's the
25
name.
hydroxy vitamin D, and it's very confusing because there's others that are just one digit different and they're useless. The 125 test, I don't know why people do it. It tells you nothing because it doesn't go up and down with vitamin D intake and it doesn't predict cancer. So it's just a 25 hydroxy vitamin D
Test.
test.
And how
We all
often should it
have
be
You
taken?
should have it every year, and if possible, the best time to have it is in February or March, because that's when it gets the very lowest, and that's the point when the cancer happens. So you want to catch it at the nadir, the very low point of the annual cycle. It's got like a sine wave, and the low point is in March. You might wonder why it's in March rather than, you think December's so cold, and I'm dreaming of White Christmas, the whole thing. But the reality is that your body is withdrawing vitamin D from the stores in the liver, in the fat, in the muscles, all winter long, and it has restored it by early spring. And so it's like a bank account that's been depleted, and it happens that happens in February and March.
Breast cancer is more than one disease.
For sure.
And you haven't talked about that here. You lumped it all together.
Well, you know what? The reason I haven't is that although there are several diseases, there's ductal adenocarcinoma, which is 80%, there's laudanum adenocarcinoma, there's inflammatory. They're all different kinds, but all except the inflammatory follow the same pattern as the adenocarcinoma of the ducts. Inflammatory is a mystery. It's 1 or 2% of breast cancer, and it does not seem to behave like the other ones. And we just don't know why. And it's a concern because it's very fatal.
There are different sensitivities. Some are estrogen sensitive, others aren't.
Well, vitamin D does its best work in either triple negative breast cancer, or it also does good work in estrogen dependent breast cancer. It doesn't care that much about whether it's an estrogen driven breast cancer. There is one study suggesting it works better for estrogen dependent breast cancer. There's a study suggesting it works best, or does really good work for triple negative breast cancer, for which you can't use other strategies. You can't block estrogen because it doesn't care. You can't block progesterone. And vitamin D helps, and it's a way to talk to the cells that isn't present for any other approach. But it is a very general approach because it's stopping the evolution in the first place. And in a way, it doesn't matter how much estrogen I push into a system. If it's orderly, if it's a single layer of epithelial cells living their life and being replaced, it doesn't matter whether there's high estrogen or low estrogen. The places in the world where the women are, there's probably estrogen coming out their ears, and near the equator, and they're not getting breast cancer. So it really isn't the cause of breast cancer. And it's kind of a nasty approach to it because it is no fun to have your estrogen cut off. And we all, a woman has to go through menopause, but you don't want to do that earlier than is needed. So what's going to happen, and probably will happen with Jolie after she has her ovaries out, she wants to be an actress. She wants to lead her life. She wants to look beautiful. She wants to be happy. She doesn't want hot flashes. She doesn't want any of that. She's probably going to have to take estrogen. And then she's got to worry, now what's the estrogen doing to me? And so, to me, I think it's best for us to get away from those hormonal etiologies because they drive us into crazy boxes that they're hard to get out of.
How about mammograms, once a year or twice
Mammograms, well, not more often than every 2 years. One study showed that if you did it every year, the mortality was worse than if you did it every 2 years. So you would think, just by logic, I have to get it every year, I have to get it every month. But it's not true. There's, at 2 years is the optimum. And then the radiation starts to rear its ugly head. And the breast is not especially sensitive to radiation. But you do it enough, and then you will begin to see it. And women that are BRCA1 positive, they are more likely to get breast cancer if they have mammograms because they are very radiation sensitive. And most of the people don't know whether they've got it or not. So it might be safe to assume, well, maybe I do have the gene, in which case I wouldn't want to get mammography more often than once every 2 years. And I would tell the mammography department, you get it right the first time. Don't go taking 6 pictures of me because it wasn't aimed correctly. That's 6 times the dose. I would make, if I were the consumer, I would speak up because normally people don't. And if you ask them how much radiation, they'll say, it's the same as spending an afternoon on a beach. Something like that, which is just a lie. If it happens to be outside of Fukushima, yeah, that's probably true. But any other beach, it's the same radiation inside or outside. It goes through wood, it goes through, building material. So it's all made up. And it is too big a dose. And it's not good to have multiple films unless you saw something on the first film and decide, well, now we got to get a close-up of it. And I see that happening too. There's too much exposure. And it's such a false sense of security. You're thinking, man, I'm doing the right thing. And it doesn't prevent a single case of breast cancer. It's not like colonoscopy, where you remember, was it Katie Couric had her colonoscopy on TV? It was quite something to see. I rather enjoyed it. And because she was so strong and she stuck with it and the tube went in. And she didn't chicken out. She could have said, wait, let's do something. And that will help because you'll find the tumors and then you'll cut them out or burn them out and then you don't have cancer. Mammography doesn't do any of that.
Okay.
It does not prevent cancer. So
Time for 1 or 2 more questions here.
Quick question. In the Muslim culture, women keep covered up and they're not allowed to go out of the house without the company of a male. And I would think that they would all be very severely deficient and therefore have a very high incidence of breast cancer. I wonder if they do?
Yes, there's a new paper on it.
Yeah, well, it's tragic. I think the Muslim community got to be made aware of this.
Oh, they should be. Yeah, I mean, it's not fair to deprive people of something that they need.
Wow, that's fantastic.
I agree with you, sir. One of the reasons I showed that picture is it's actually outrageous. Now we know.
I'm a primary care physician, and I saw young women with really fibrous breasts. They sometimes needed to be biopsied, and you get these levels of, fibrocystic breast disease. So can we assume that the fibrocystic breast disease will improve with vitamin D as well?
Yes. Because vitamin D inhibits proliferation, and it's probably not going to do, oddly enough, as much for fibrocystic breast disease as it will for cancer itself. But it'll probably help a little, would be my conjecture, based on what's been published so far.
I think we've run out of time. Dr. Garland will be here afterwards to handle questions. So we thank Dr. Garland for his comments here today.